A pleasant good morning. I am Claudia Beckford Harvey, and I'm speaking to you once again from the beautiful island of Jamaica, West Indies. It's a pleasure to be here once again. Today, we'll be looking at teaching methodologies to assist academically prepared nursing students perform competently. I hope you will have some information reinforced, and I hope you will learn something at the end of this 15-minute presentation. So the objectives, we will define some key terminologies. We will also explore the different learning styles of adult learners, and we will examine methodologies designed to help academically prepared nursing students perform competently. So, according to Billings and Halstead, effective teaching methodologies for academically prepared nursing students should focus on ensuring that students understand theoretical knowledge and competent application in diverse settings. Who is an academically prepared student? Connolly describes the academically prepared student as those who possess key cognitive strategies, foundational content knowledge, and self-management skills that enable them to succeed in post-secondary education and career. So then, who is the academically prepared nursing student? Billings and Halstead describes the academically prepared nursing students as those who have acquired the necessary foundational knowledge and critical thinking skills required to succeed in a nursing program. Such students are ready to engage with more advanced material and participate in complex discussions, as well as to develop new practical skills. What are teaching methodologies? Teaching methodologies are the strategies and techniques used by teachers to enable students learning. According to Billings and Halstead, effective teaching methodologies are those that are learner-centered, foster critical thinking, and facilitate the application of knowledge in practical settings. Utilizing a myriad of teaching methodologies that cater to different learning styles reinforce information and enhances competency. Miriam and Birma posited that understanding the learning styles of adult students is crucial for creating effective educational experiences. Now we will look at some particular teaching methodologies. So first, we will look at the diverse teaching methods. These incorporate a variety of teaching methods to cater to the different learning styles of learners. Here, these involve lectures, interactive face-to-face lecture discussions. We can also have those live online interactive lecture discussions via Zoom Classroom as one platform. We can have webinars, discussion forums, group projects, practical exercises, and of course, we can also use our multimedia. So we will now look at the simulation-based teaching methodology. The simulation provides a safe environment for students to practice and refine their clinical skills. We can use high and low fidelity mannequins and virtual reality scenarios, which can mimic real-life patient situations, helping students to develop critical thinking, decision-making skills, and procedural skills. The benefit of this is that it enhances clinical skills, improves confidence, allows for safe practice of complex procedures, and provides opportunity for reflection and debriefing. Now we will look at the case-based methodology. The case-based methodology involves using detailed patient cases to promote problem solving and application of theoretical knowledge to clinical practice. This method encourages critical thinking and helps students learn to manage patient care holistically. The benefit of this is that it develops clinical reasoning, integrates knowledge from different domains, and enhances decision-making skills. We will now look at the problem-based methodology. This focuses on student-centered inquiry and solving real-world problems. Students work in small groups to address clinical scenarios, encouraging collaboration and self-directed learning. Now, the benefit of this is that it promotes teamwork. It enhances critical thinking and fosters a deeper understanding of the subject matter. Clinical rotations and internships as another methodology. Direct patient care experiences are critical. Clinical rotations in various specialties allow students to apply classroom knowledge in real setting under the supervision of experienced staff, nurses, and faculty. Return demonstrations are also facilitated. The benefit of this is that it provides hands-on experience, facilitates the transition from student to practitioner, and enhances clinical competency. We will now look at mentorship and preceptorship programs as yet another methodology. Pairing students with an experienced nurses provides guidance, support, and real-time feedback. This relationship helps bridge the gap between theory and practice. The benefit of this is that it offers personalized learning, it improves clinical skills, and builds professional networks. We will now look at the interprofessional education. Interprofessional education. Collaboration is important. Collaborative learning experiences with students from other healthcare disciplines fosters teamwork and communication skills, which are essential for holistic patient care. The benefit of this is that it improves understanding of roles and responsibilities, it enhances communication skills, and promotes collaborative practice. The flipped classroom methodology. This approach involves the students reviewing lecture material at home and using class time for interactive activities such as discussions, case studies, and hands-on practice. The benefit of this is that it encourages active learning. It maximizes classroom interaction and reinforces theoretical knowledge through practical application. The technology-based or technology-enhanced learning. This utilizes online modules, educational software, and mobile application, which can supplement traditional methods. These tools can provide additional resources, interactive content, and self-assessment opportunities. Now, the benefit of this is that it offers flexible learning opportunities, it caters to different learning styles, and it provides immediate feedback. Continuous assessment and feedback is the next methodology that we will look at. Regular formative assessment, constructive feedback helps students identify their strengths and areas for improvement. Methods include quizzes, practical exams, and peer assessment. Now, the benefit of this is that it promotes continuous improvement, provides clear benchmark for competence, and enhances learning outcomes. Debriefing. Debriefing, here we will review objectives, we will look at we will review the outcomes, we will look at the lessons learned, we will look at where improvement is needed. Now we will look at 4 main learning styles of students. The acronym for this is VARC. It stands for visual, which are those learners who learn by seeing things. The auditory learner learns by hearing things. The writing, they have to either read or write. That's the way they learn. And the kinesthetic learner learns by hands-on experience. Now, we will look at the appropriate methodologies for the different learning styles. Now, the visual learner, they benefit from visual aids such as charts, diagrams, videos, field trips that can help them to understand complex content, provide handout or PowerPoint slides, with key information would be useful for them. Now, the auditory learner, they benefit from listening to lectures and participating in discussions. The read and writing learner. Here, we must encourage pre and post reading, give the students an opportunity to share with their peers. Flipped classrooms are a methodology that works well for these learners. Provide written instructions and materials. We can facilitate note taking, and we can give them an opportunity to do written reflections as well. The kinesthetic learner, as I had said, they benefit from hands-on activities. So teaching methodologies such as practical workshops, exercises, lab simulations, real-world problem-solving, reflection, role-playing, and case studies work best for these learners, according to Coffield. Now that we know the methodologies, how do we now implement these methodologies? First, we have to integrate theoretical and practical training. We must ensure that classroom teaching is closely linked to clinical practice. We must also foster a supportive learning environment. We must encourage open communication, provide resources, and support students emotionally and academically. We must also use evidence-based training practices. Here, we will stay up to date with current research on effective teaching methodologies and incorporate them into the curriculum. We must also engage in continuous professional development. Here, educators should continually develop their teaching skills and stay current in clinical practice. And now to conclude, to effectively teach nursing students, it is essential to recognize and cater to their diverse learning styles. Providing practical, relevant, and flexible learning opportunities while promoting autonomy and critical thinking can significantly enhance their educational experience. By integrating a range of teaching methods grounded in evidence-based practice, educators can help academically prepare nursing students achieve competence. Thank you so much for your time. I appreciate your listening. These are my references. And thank you. Now I will listen for your questions and comments, and we'll have a discussion, and you can make those discussions, questions and comments in the comment section below. Thank you so much. All the best now. Bye.